Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Today, we're going to talk about paroxetine, a commonly used antidepressant and anti-anxiety medication. We'll explore how and when it's used. Paroxetine is prescribed to treat various conditions like depression, generalized anxiety disorder, obsessive-compulsive disorder, and panic disorder. It can also be helpful in cases of post-traumatic stress disorder and social phobia. How does paroxetine work? This medication works in the brain by increasing levels of serotonin, a neurotransmitter that helps improve mood. It does this by blocking serotonin reuptake, which allows more serotonin to be available for neurons. Regarding dosage, it usually starts with a low dose, for example, 20 milligrams per day. Your doctor may adjust the dosage based on your response to the treatment. It's essential to take it at the same time every day and not stop treatment without first consulting your doctor. Like all medications, paroxetine can have side effects. Some of the most common are nausea, dizziness, and drowsiness. In rare cases, it can cause more serious effects, such as mood swings or suicidal thoughts. It's crucial to tell your doctor about any unusual symptom. In short, paroxetine can be very effective in treating various mental disorders. However, it's essential to follow your doctor's instructions and pay attention to any adverse effects. Remember, your mental health is important. Help is always available. Take care.
If you've made it this far, let us know in the comments why you're using this medicine.